Okay, in October of 2021, NHGRI sponsored a workshop that was titled The Future Directions of the NHGRI Analysis, Visualization, and Informatics Lab Space, which we affectionately refer to as AnVIL. Dr. Marylyn Ritchie was a participant and a moderator at the workshop. She joins us today to present the findings of the workshop. So Katie, do you want to bring up her slides? So Dr. Ritchie is Professor of Genetics and the Director of the Institute for Biomedical Informatics and VP for Research Informatics at the University of Pennsylvania's Penn Center for Precision Medicine. Marylyn, thank you for joining us today and making time for this presentation.
Absolutely. Well, thank you so much for the invitation to be here. And as a member of the External Consultant Committee for AnVIL, I'm really happy to tell you about this workshop that we had in the fall. So next slide, please. So what I'm going to tell you about today, first I'll give you an overview of AnVIL, pretty brief, but just to make sure that everyone's on the same page. I'm sure that the council has heard much about AnVIL in the past, but just to bring you up to speed with where AnVIL is today. And then I'm going to talk about the workshop that was held that was titled The Future Directions of the NHGRI AnVIL. I will talk through the SWOT analyses that were done, so looking at strengths, weaknesses, opportunities, and threats, and then the next steps for the AnVIL program. Next slide, please. So first, I just want to give an overview of what AnVIL is and what the purpose and kind of functionality is of AnVIL today. So AnVIL is the Analysis, Visualization, and Informatics Lab Space at NHGRI. And this is a platform that sits on top of the Terra platform, which is a cloud-based platform. And its intent is to provide workspaces for researchers to both upload their data and then also to perform statistical and computational analyses. The Terra platform itself provides users with a lot of different functionality to do searches on the data sets that are hosted by AnVIL, and it leverages established pipelines so that people can do exploratory analyses. Now, what you're looking at in this slide is a screenshot from AnVIL, and then a lot of the different functionalities. So for one, there is an integrated development environment so that programmers and bioinformaticians that are able to do coding can use a code editor. They can kind of take their own analysis tools to the platform and build them. There are automation tools so that you can run across these very large data sets in an efficient way. And then also a debugger or a way to kind of find the errors in your code. The Terra platform also includes Jupyter notebooks and Whittle. And then in addition, the AnVIL team added tools that are specific to the genomics researcher community, such as Seeker, Bioconductor, the Galaxy R Studio, and then DocStore soon is going to be adding the UCSG genome browser as well. And as a next step, AnVIL as it exists today has a lot of functionality for both users to upload their data and also do analyses. But we really wanted to get feedback from the community about where should AnVIL be headed, what additional tools are needed to ensure that AnVIL is addressing the needs of the user community, and really how is AnVIL positioned today amongst the genomics community that's using it. Next slide, please. So as Rudy mentioned, the workshop was held in October of 2021. This was a virtual workshop that was throughout one afternoon. The goal was to identify the gaps, challenges, and future opportunities related to the investments that NHGRI has made in the AnVIL cloud-based infrastructure, the tools they provide, and the services. Throughout the workshop, we discussed both the current state of AnVIL and then also identify the activities that they really need to focus on to expand the platform, to diversify both the platform and their user base, and then also to support the AnVIL user community. Just in terms of perspective on the timing of when this workshop was held, and as we're talking about this now, the AnVIL program is in their 4th year of the program. And so they're starting to think about what the renewal might look like. And so the timing of this workshop was really designed to kind of take a bird's eye view of how are they doing and where should they be headed, both in this last stage of this funding round for them, but also where should they be headed in the future. Next slide, please. So the way that the workshop was designed was in breakout rooms. So we all came together, discussed the goals and kind of our main mission for the workshop, but then broke out into breakout groups. The 4 areas included data submission and consortia engagement, analysis tools, infrastructure, and outreach and training. And then as participants, we could join multiple breakout groups and kind of go back and forth between them. They were held 2 at a time concurrently. So we had 2 sessions and then came back together, and then 2 more breakout rooms and came back together. Next slide, please. Across all of the breakout groups, we had cross-cutting themes that the group discussed. These include how cloud-based platforms can serve the needs of the genomics researchers. As I'm sure you can imagine, our ability to leverage cloud platforms has a huge diversity of needs across different types of genomics researchers, from your very sophisticated bioinformatician to a bench scientist or clinical researcher who is not going to be writing bioinformatics code. We want this cloud-based system to serve both groups. So how do we do that effectively? What tools and services would be better to support, in particular, the clinical genomics researchers? A lot of the data that is included on the AnVIL platform are clinical genomics data. And so we wanted to talk about, what tools do they need so that that research community is able to leverage the functionality of this cloud-based system? And then how do we improve the interoperability with other cloud-based resources in a federated genomic data ecosystem? I'm sure you're all aware that multiple NIH institutes are setting up similar and complementary cloud-based platforms. So how do we work across the research community and have AnVIL interoperable with these other systems, which part of the goal of cloud is to be more interoperable. So how can they do that effectively? Next slide, please. So in total, there were 105 attendees at this workshop. They included invited participants and assigned discussants. This was done so that we were sure that we had both specific expertise within the different breakout groups, but also the diversity of voices. So we allowed some individuals to choose freely, and then others were assigned to different groups based on their content expertise. We included the AnVIL staff, NHGRI personnel, and the AnVIL External Consultants Committee, of which I am one of the members. Next slide, please. As I mentioned at the beginning, we used the SWOT analysis framework to really work through this. So we looked at the strengths, where does AnVIL excel today? Their weaknesses, where are they at a disadvantage? The opportunities that they have for growth and improvement, and then the threats. What are the factors, both internal and external, that would jeopardize the future of AnVIL? Next slide, please. I'm going to just very briefly mention a couple of strengths. The goal of the workshop was really to look at the future, and I think we could have probably spent the entire day talking about the strengths. The AnVIL team has done a very good job of setting up the platform. There's a lot of data uploaded. There's a lot of functionality and analysis pipelines that are available. They have had a strong commitment to data security. The platform is versatile and has a lot of training capabilities to train students as well as other researchers for using the analyses. They've really focused on interoperability and leveraging ontologies such as that by GA4GH, as well as working with other cloud-based systems. But I don't want to spend the majority of my time today talking about the strengths, because same with the day of the workshop, that's great. They have done a tremendous job, and overall the feedback was extremely positive. But we really wanted to dig in on the weaknesses, opportunities, and threats, because that's where they have the opportunity to grow and where they can head in this last stage of the funding, but then also in looking towards the renewal, where should they be headed? So next slide, please. So the weaknesses, where is AnVIL at a disadvantage currently? We discussed that the curation of some of the tools and workflows could be improved through facilitated searches so that users can find them more quickly. As I mentioned, there's a lot of functionality on the platform. And so if a user doesn't know what the name of the tool is or the pipeline that they're looking for, it might be hard to find. There's a limited amount of phenotypic harmonization across the different data sources within AnVIL. So AnVIL has data from many of the NHGRI consortia that you're aware of. And within each consortia, they've done data harmonization, but that hasn't necessarily been done across the consortia as much as it could have been done. AnVIL may have a platform to provide some of that capability. The relationships between AnVIL and the data coordination centers of the other consortia could be better defined. How much should be done and led by the AnVIL team versus the others? We mentioned that they should think about video documentation as a way to make it kind of a sustainable training environment for users. They host workshops and training events, but if people can watch them kind of in video, play them back, that would be really useful for them. And then also that they don't have embedded personnel that are clinical researchers, that have the mindset and the perspective of the clinical researcher. And so we recommended that they have clinical researchers embedded in their team to help bring that perspective to the things that they're developing. Next slide, please. We identified a number of opportunities where AnVIL can grow and improve, and you'll see some of these are building off of the weaknesses. We do think that creating a safe space for users to upload some of their own data sets would be important. AnVIL has data that is shared through controlled access, but perhaps individuals have other data that they would like to host there, but they're hesitant. And so thinking about different types of safe spaces for individuals to upload or consortia to upload data sets into the system before making them accessible to all users in the system. Thinking about transitioning some of the tool development and analyses for discovery, in addition to acting as a data repository. So as I mentioned at the beginning, the goal is for AnVIL to both be a place for people to use data, but also to bring analysis tools. And a lot of users are using it more so in the data repository framework. We really want to transition to having the perspective of tool development and analyses. The AnVIL team could demonstrate how AnVIL can work for the clinical community, adding additional data standards and data models to improve the interoperability model for Terra. The outreach team, we talked a lot in the outreach groups about how to build more robust programs in outreach and how AnVIL is being used in different communities. Thinking about interfacing with the next generation of scientists and integrating a more diverse set of human genetics data sets and reference genomes and making them backward compatible so that users are able to use both the latest versions of the data, but also the historic versions. Next slide, please. And then what are the factors jeopardizing AnVIL? The biggest one that came up, the biggest two I would say, are cloud costs and then the challenges with using cloud platforms. They're not inherently easy to use, and building tools and making them accessible to users where they are is going to be one of the big opportunities and threats for them to really get through. They do face data security threats. However, they've done a really great job with security thus far. So we didn't think that it was an issue today, but it's something that they need to continue to be mindful of. And then thinking about the user investment in the skills using these platforms. So because each cloud platform has its own set of tools, there's a limit of users' skill transferability between AnVIL and other platforms. So starting to partner with those platforms and make sure that that users don't feel like they're wasting their time on one platform when other data or other tools that they need are on a different platform. Next slide, please. So some of the challenges that were more cross-cutting had to do with this culture change of getting more investigators who have historically worked in local computing resources on premise at their institution to kind of embrace this cloud system is a culture change that they're going to be working through, like many of us, as even within our home institutions. I think there's this tension between on-prem and cloud. Onboarding users who are inexperienced with cloud resources is a significant lift that they need to face. And the cloud costs are both a practical barrier and also a psychological barrier. Many believe that cloud is much more expensive, and so they're hesitant to even begin to learn. I will say there was some conversation around perhaps having a free tier, at least for new users to just get on at first and become familiar. And that's something that the AnVIL team was going to take back and talk about. Next slide, please. Other cross-cutting themes, as I mentioned, having more support for the clinical research community was clearly something for them to think about. How do they use tools related to clinical genomics implementation? A lot of the data resources that are currently housed there, data sets like the eMERGE data set, for example, are data sets that researchers in the clinical genomic space may want to use for implementation. So adding those investigators who can bring the perspectives of the research priorities into their development team would be really useful. And then working with investigators to identify use cases. I think that group is really focused on the development and not necessarily kind of taking that bird's eye view of how might a clinical researcher use this for implementation. They also need to establish trusted relationships with clinical sites and hospitals, and then support for the clinical data in a way that's consistent with everything being done by ClinGen in their curation process. Next slide, please. A lot of work needs to continue to happen in the outreach and training. This needs to be accessible to a broad group of users, both those that are bioinformaticians who know how to code all the way to those that can't. They talked a lot about generating some of the more popular analysis workflows and then having video guides to go with those, developing streamlined processes for understanding how the payments work and how easy it is to access the data. As I mentioned earlier, this onboarding of kind of getting people onto the platform at first is a challenge, and especially that's the case in users from low resource institutions. In many ways, that's one of the highest priority research groups because they don't have the on-prem resources. They don't have the local compute clusters to download the data. And so one of the beauties of AnVIL is having the data in the cloud, that these researchers don't need to download it, but we need to get them onboarded and trained on how to get onto the AnVIL to use the data there. We want to leverage the research communities that are funded by NHGRI to build a sense of community around the platform. Many of us are using data sets that are already housed in the platform and probably using similar analysis workflows. So how could we get those and work with the AnVIL team to get them there and share them amongst the community? And they also plan to identify more use cases to demonstrate AnVIL's capabilities and ways to promote them. Next slide. Finally, the interoperability, which is something that I mentioned. There's a lot of different areas of interoperability. Some of them I've already mentioned today, but really incorporating the harmonization between the data sets, specifically on the phenotypic harmonization, using common data models and data standards will improve the semantic interoperability. Increasing the search capabilities, as I mentioned earlier, is going to be really important. And really clarifying that relationship between AnVIL and the data coordinating centers at these different consortia so that they don't have duplicated efforts in some of the harmonization and standardization efforts and then lacking in other areas. Next slide. So all of the content from the workshop is hosted on genome.gov at the URL that's shown here. The next step is really for NHGRI to prioritize AnVIL's future activities and start to prepare for their renewal. Next slide. So thank you very much. I'd like to thank certainly the workshop participants and organizers and the AnVIL team. It was a great workshop, and thank you to the AnVIL team and NHGRI staff that helped me to put all of the materials together for the presentation today. Thank you.
Okay, thank you, Marylyn. I'm sure she's willing to entertain some questions. She does have a hard stop at 2 o'clock, however. So Katie, would you take down her slides? Start with Joe, please.
Yeah, can you hear me okay?
Yes,
I can.
You can.
Yeah, Marylyn, thank you. Very great presentation. Thank you for the work. You use the word security multiple times. Is your definition of security, I mean, obviously authentication, cybersecurity, but does it also incorporate standards around data privacy?
It does. It's both kind of the access of the data and keeping it cyber secure, but also the data being de-identified in such a way that you can't identify the participants. And I don't know if Ken or Valentina want to say more about what the AnVIL team has been doing. I know I've signed up to be a user, and you sign data use agreements. Your institution has to sign. You are not to re-identify or attempt to re-identify participants by data linkages. But I don't know, Ken or Valentina, do you want to add anything to that?
I guess specifically it would be around things like GDPR and things for, right to be forgotten and things like that. That actually is super important in clinical environments when you deal with hospitals. California, Michigan, as well as global communities are enforcing those. And I just was curious if you adhere to and can execute to things like right to be forgotten and things like that.
So I'll take a stab, Valentina, if you want to go afterwards. So a lot of the data sets that we have are consortium generated. And so the AnVIL really does follow the guidelines and suggestions and policies from the consortium also. So in the case of the policy that you mentioned, when the consortiums have that requirement, then the AnVIL will work with them to facilitate meeting the expectations of that requirement. But it does vary depending upon the data owners, because as we mentioned before, AnVIL is not the data owners, AnVIL is the data stewards of this resource. Valentina, do you want to add anything?
No, I don't have anything to add. Thank you.
Okay, Mark, go ahead, please.
Thank you for your presentation, Marylyn. I'm wondering if you can summarize in a bit more detail how big and who the AnVIL user base is now, and then what you think that should look like at the end of the next renewal phase. I know you said a bit about trying to better enable naive users and folks from the clinical genomics community, but I wonder if you can elaborate a bit more on what that user base might look like.
Well, I actually don't know what the current total numbers are. That might be something that Ken or Valentina have, but maybe I'll first just say where I think the user base should be. I think it should include, in particular, our trainees across the institutions working in genomics. And it's actually one of the things that came up at the workshop is using our NHGRI funded training grants as one opportunity to start to get the word out. We have a lot of training grants around the country, and a lot of the trainees who are the perfect candidates, certainly in the US, for using this platform would be that community. We talked a lot about the lower income institutions, and some of our ECC members are from some of those institutions. We've been talking a lot about how to get those institutions more onboarded. That's going to take a little bit more training in the pipeline of, even having a lot of students at those institutions interested in using the data sets, but that's something else that they talked about working on. But I don't have the numbers and of the current user base. Ken or Valentina, do you have that handy?
We don't have them handy, but I can tell you right now that what we spend a lot of time doing is to work with members of the NHGRI funded consortia. So first and foremost, the AnVIL has started as a data sharing platform. So we've been working with big projects like the CCDGs, the CMGs to onboard their data in order to share them with the scientific community. We're still very much in the middle of the data ingestion process and the study registration with dbGaP and so on. So while we're getting consortium members to work on the platform, we don't have a lot of members from the outside community to submit data access requests and use them on the AnVIL platform. So number one, in terms of data sets that have been shared, they're publicly available. The most popular one is probably GTEx and the 1000 Genome Project and so on. So those clearly attract more people. But this is definitely an area that we need to grow. And it will depend a lot on the amount of documentation, training materials that we're still in the process to generate. We're not where we want to be, but that's understandable given that we are only in the 4th year of the program. So.
Then, Lynn Jordy, please go ahead.
Thanks for a great presentation, Marylyn. A lot of us have used dbGaP in the past, and I think it would be fair to say that accessing the data requires a fair amount of persistence and patience. So I was pleased to see that one of your priorities is ease of access to AnVIL. Do you think that, and maybe it's hard to make this comparison, but I'm wondering if compared to dbGaP, will AnVIL be easier to access?
So from my experience so far, I would say definitely yes. I think it's already easier to access than some of the work that's gone into access some of the data sets from dbGaP. And I think the added benefit is once you've done the work to access the data in the AnVIL, you don't have to download the data, figure out how to store it, where to store it, and then build your analysis platforms. Once you have access to the data, it's already stored. You can just learn, read through the documentation to learn how it's stored, and then start running analyses. And if the platforms that you, or analysis pipelines that you want to run have already been built on the AnVIL, you can just get right to work instead of having all that other downstream work. Because dbGaP, you could only download the data. You couldn't actually use the data in its native state where it was. So I think it will be easier, but then, as I said, the added benefit is once you have access, that now you can get to work immediately instead of now having to figure out what to do with the data.
That's great news. Thank you.
Sure.
Marylyn, thank you so much for coming and for contributing. I know you have to go. Do you have time for one more question? I see.
Sure.
Iftikhar. Okay, Iftikhar.
Yeah, thanks, Marilyn. That was really an excellent summary. This question is for you as well as Ken and Valentina. How can we migrate other data sets that are relevant to genomic research into AnVIL? Is that a possibility? For example, UK Biobank, all of us, or some of the NHGRI cohorts that have been described, MACE and others. Is that a possibility, or do we have to tunnel into those clouds?
So I think where it is today, it's not a possibility yet, but I think the conversations are happening about how to make them more interoperable. And it's certainly something I know. So I'm also on the advisory panel for All of Us, and I'm on the International Scientific Advisory Board for the UK Biobank. And so I can say these conversations have happened across the board. How can we, it's the same user community that we would like to be able to access all three of these types of resources, but currently it's not there. I don't know, Ken or Valentina, if you want to say any more about, I don't think we have it figured out as a community yet, but I know there's interest.
Yeah, no, you make a good point, Marilyn. Yes, this is something that we're actively working on. We have programs such as the polygenic risk score, risk methods in diverse populations, primed, which actually, as you're familiar with, really is trying to understand how we can get data sets for secondary use that are in these other different repositories. There are some things we have to be mindful of, like there's some of these data sets have restrictions on redistribution of those data sets. So we have to be mindful of those situations, but where we can work arrangements out, we're trying to have those data sets uploaded in the AnVIL and accessible. We are actively pursuing those venues, but we have to keep in mind of those restrictions. And we are also looking to our extramural colleagues to help us understand what's the best way to move forward with that. But it is something that we're actively pursuing, and in some ways we make good progress. Other ways we have to go through extra levels of processes to get there. So Valentina, if there's anything you want to add to that.
No, that's right.
Okay.
All right, Marylyn, thank you very much. We appreciate you taking the time and working with us on that presentation. Thank you.
Thank you.
All right, for the rest of the council members, we're 2.5 hours into this meeting. We're very much aware of screen fatigue, so we're going to take a half-hour break. Please do not disconnect from the meeting. Just turn off your microphones, turn off your cameras, and then rejoin at 2:30. And we'll come back to the concept presentation for multiomics for health and disease. We'll see you then.